Welcome back to Ophthalmology for undergraduates and postgraduate beginners. We are nearing the end of case presentation for undergraduates. Today our topic is summarize to diagnosis. What is this summarize to diagnosis? We are going to ask entire history from the patient. We are going to completely examine the patient and put it on the records. But while explaining about the particular patient to a doctor or your teacher or an examiner, sometimes they may not have time to listen to everything what you are going to say. They will just ask you to summarize this case, whatever you have seen, and tell the diagnosis. Sometimes they may ask you to tell the diagnosis alone. So it is always better to put everything into a nutshell and tell the diagnosis to the examiner or your teacher or whoever you are going to explain to. While summarizing the case, what are the things we have to tell? We will see one by one. One is we have to tell the gender of the patient, male or female, the age of the patient, where from he is coming, that is the locality and occupation. We have to mention the chief complaints of the patient completely. We have to tell about the history of presenting illness, all positive histories and relevant negative histories. We are going to explain about the chief complaints in summarizing also. We are going to tell all the positive histories we have asked and got from the patient. We have to sometime tell about the negative relevant histories also. What is this relevant negative histories? You know that cataract causes painless loss of vision. Glaucoma causes painless loss of vision. So, when you are dealing with a cataract case or a glaucoma case or any other case like retinal detachment, patient usually does not have any pain at all. So if the patient does not say that he is having a pain while eliciting the history of presenting illness, so that history is very important. You have to tell that patient is not having any pain. Next thing is you have to tell all the positive histories in the past history, personal history, family history, treatment history and allergic history. Everything has to be told. In the general examination, if there are any abnormal general examination findings, that has to be told. Otherwise you can tell general examination is normal. Local examination, you have to tell abnormal findings in the eye for the right eye separately and left eye separately. This is how we have to summarize it to the examiner or the teacher. After doing this, we have to go to the diagnosis. Once we have summarized the particular case properly, now it is our turn to tell the diagnosis. Diagnosis, there is a protocol to be followed. The diagnosis for the right eye has to be told first, followed by the left eye. While telling the diagnosis, we have to make sure the following 4 parts are present in the diagnosis. Without these 4 parts in the diagnosis is incomplete, even if it is not an ophthalmology case. It applies to all branches of medicine. What are the parts of diagnosis? First is the anatomy. We have to tell properly which eye, which structure, which portion of the structure is affected. Second is the pathology. What is the disease that the patient is having or suffering from? The third part is what type of pathology it is, what stage of pathology it is, what is the grading of the pathology. So some diseases may have types, some diseases may have grading, some diseases may have staging. So whatever it is, we have to tell it in the diagnosis. And last but not the least, the cause for the pathology, that is the etiology that has caused this disease in the patient has to be told. So the diagnosis is complete only when you tell it according to the protocol with all the 4 parts. Thank you. We'll stop here. We have another 2 more videos to talk about as far as ophthalmology case presentation for undergraduates. We will see in the next video.